The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about liposuction. My first guest is an expert on the topic, board-certified dermatologic surgeon, Dr. Armon. Dr. Armon, welcome to the program.
Nice to see you, Randy.
Hot topic right now, liposuction. Before we get into today's topic, tell us about your practice. I guess this is mostly, what you do, what you focus on.
I've been in practice for 15 years in Beverly Hills, and my practice is really based around liposuction surgery. It's the only surgery I do, and I've got a lot to say about it.
That's rare to hear that, by the way. You know, doctors from all over the country fly in here, we interview them, and I don't hear a lot of doctors that's all they do. In fact, I hear they don't like doing lipo. Why do you like doing lipo?
Well, that's true. You know, I think
it's tedious, it's time-consuming.
Yes, I think a lot of surgeons really view it as being grunt work, and they do a lot of different procedures. They kind of don't give as much importance to liposuction as they need to.
Okay.
I just really enjoy doing it. I enjoy all the ins and outs of it. I think that's incredibly technique dependent, and there's a lot of artistry to liposuction.
Okay, now, I love your line that, anybody could make people look good in clothing after lipo, but it's making them look good naked or in a bathing suit. So that's, does it take you longer to do it right? What defines a great case, in your opinion?
Well, I think a great result really comes down to two reasons. Number one is proper evaluation about who truly is a candidate for liposuction surgery. So let me make it clear about that.
Okay.
Liposuction is a tool to target genetic disproportion. It's that simple.
So it's only for thin people?
No, it's I do people who are thin, I do people who are overweight, I do people who are normal weight. To me, it has nothing to do with that. I'm viewing my role in terms of how I'm balancing their body out. It's the patient's responsibility to keep their weight down and to exercise. And to me, whether they do it afterwards or before, it makes no difference.
Really? So you don't say, hey, go lose weight first, do everything you can, then come back?
No, I don't do that. And some surgeons do that. They say that you need to lose weight first, get to your ideal body weight, and then do liposuction. I view it as a balancing procedure. And many times, if I take somebody who is overweight and out of proportion also, and I reduce their disproportion, it motivates them many times to then go and lose weight and to get in shape. On the other hand, if you take somebody who is overweight and in proportion, and you lipo areas on them, which many times goes on, you actually have done them a huge disservice. You've thrown them out of balance or proportion permanently.
Okay.
And in the revision work I do, that's a big part of it, so rebalancing a body out.
So when the patient comes in, though, on a consult, do they tell you nowadays, this is what I want? And what goes through your mind when you're evaluating a patient?
Yeah, well, again, I think the evaluation is so important. And like I tell patients, make sure in the evaluation, pay attention to how the surgeon's being. Is he educating you? Is he guiding you? Or do you feel sold to with things? When I'm evaluating somebody, first of all, they come in with their wish list of what they want.
You told me you don't listen to the patients.
But I really don't. I don't even look at the chart to see where they want to
Interesting.
do it.
Okay.
I talk about my approach and my philosophy, and I evaluate them comprehensively from their neck down to their ankles, and I make the determination what should be balanced out in them. Because I'm the expert in this. I'm the one who really should be guiding them, and I'm going to bring up with them what I think should be done. Many surgeons do it the other way around. The person comes in and says, oh, my abdomen bothers me, I'm getting fat there lately. They take a look at the abdomen only, and they say, sure, we'll do liposuction on you. Huge mistake. If you see a surgeon who's not comprehensively evaluating you, they can throw you out of balance of proportion, and that's a very important point.
You mean where you'll look odd, maybe in a bathing suit, or what? Help me understand. What do you mean by that?
Well, absolutely. You're going to store fat wherever you have fat tissue remaining. So when the fat is being removed, the tissue is being removed, you're shifting somebody's balance of proportions. There's that point that lipo can make you gain weight in other areas. Well, it's partially true and partially false. And it's true, the fat will go to other areas, and that's why the surgeon has to pay attention to balance of proportion. He can throw you out of balance of proportion. So I view my role as to balance a person's body out. It's a patient's role, like I mentioned, to lose weight and get in good shape. And they're two separate things. Okay,
now what are the most popular areas of the body you treat?
Well, it depends. I do a lot of men also, so it depends if you're talking about a man or a woman.
So for women, what is
For
it?
women, I do really all over the body. But the most common areas, probably the outer thigh area, the saddlebag area, the abdomen definitely, the inner thigh area, the flank and hip area. Really for women, it's all over the place.
The bra strap area? Is that
I do a lot
area?
of, no, absolutely. I do a lot of backs too. I think the back's a great area to do. Many times people have fullness there, and then with time, it tends to want to drop and get worse. You know, I call those areas gravitationally prone. If you go to my website, I label specific areas gravitationally prone areas. What I mean is that with time, they drop and get worse. And if you catch them with lipo, not only in the short term do you get the improvement, but long term it tucks the area up so it stays tucked up.
Like the neck, for example.
Like the neck, for example. That's right. In men, that's a very common area to do. In women also, if you don't catch it early, if you've got fullness, it drops and drops and drops, and then it gets worse. And
So
your only
if you do
options.
it earlier, what happens? I mean, it sounds obvious, but what's the benefit?
Well, if you do it
catching
early on, before the elasticity has dropped too much, not only in the short term does it tuck up and stay tucked up, but long term it really reduces or even can prevent the need for a facelift. And I think for a man, that's a huge benefit.
Arms on women, same thing. Catch it early.
Absolutely, arms on women. You know, when women's arms are full, when they're younger, their 20s, 30s, or 40s, it gets worse with time because it gets looser with the gravity. So by removing the weight of the fat, it reduces the weight that the skin is holding, and also it causes the skin to lift up and tighten. It
like
stays more
affirming?
tucked up. That's right.
Okay.
It's like affirming. You're actually providing support. So the bigger benefit begins to be years later. If you didn't do the liposuction, it's going to drop, and then your only option is a surgical lifting procedure.
I want to ask you a question because it seems like the world out there of lipo is divided. Some do it under general, some do it under local. You like local. You have specific reasons why. Tell me about that.
Well, you have two groups of surgeons in the U.S. doing liposuction primarily. You have plastic surgeons and you have dermatologic surgeons like myself. The plastic surgeons almost always like to do under general anesthesia. The dermatologic surgeons, like Jeff Klein, who I know was on your show, like myself, the dermatologic surgeon.
Came up with tumescent liposuction.
That's right, where it's done purely under local anesthesia, where the patient is essentially awake. It has huge advantages. So you're either doing it under general or you're doing it under local. Under local, there's three advantages. Number one is safety. There is no comparison.
So they're somewhat awake, in a way.
That's right, they're conscious.
Okay.
So the first part of it is putting a numbing fluid in, we'll talk about that, and then the next part of it's a liposuction. And during the liposuction, they feel really nothing. It feels like, kind of like a massage, you're feeling pressure in the area. But back to the benefits of local anesthesia. Number one is safety. There's no comparison. Lipo under general has a much higher complication and mortality rate, actually about a 1 in 5,000 death rate under general anesthesia.
Right?
Under local, it's never had a death in over 20 years in millions of patients when done properly.
It just seems very painful, though. I mean, that's what a fear of mine would be. It sounds like I don't want to be awake during that.
You know, I'd feel the same way too. I don't like things done to me. When I get time for a flu shot, I'm kind of like cringing a little bit. But it really isn't bad. The first part of it is putting a numbing fluid in.
So it's not something they complain about, I should ask. That means when it's all done, they don't say, what do they say?
Afterwards, almost all the patients say, wow, I'm amazed at how easy it was. They're all scared about it beforehand, and afterwards say, wow, you know, it really was so easy. I'm shocked at how easy it was.
The part I'm not getting, though, is why is it a better result doing it local?
Okay.
That's the part I don't get.
So back to the benefits. Number one is safety. Okay, we talked about it. Number two is recovery. Much faster recovery because the local helps prepare the area, allows much more pure fat removal, very little bleeding, much less bruising. You walk out feeling great. 2-mile walk the next day, back to work in a couple days. Patients are shocked at how easy it is.
Okay.
But let's talk about results, because that to me is the biggest benefit of local anesthesia. Under general, think about it. You're lying there with a tube in your mouth, dead weight, being rolled around at best. It's impossible to get proper positioning. Liposuction is probably the only surgery I can think of where you actually want or need your patient moving to assume proper positioning.
Interesting.
Because if you're at the wrong angle with your contouring and sculpting, you're either jabbing the muscle, which causes unnecessary bleeding and trauma, or you're poking or jabbing or tenting the skin. So let me demonstrate what I mean about that. Okay. So the first part I was mentioning is there's two aspects to the way I do
by
that.
the way?
These are called cannula. This is a cannula. That's right. And there's two types. This is called the infiltration cannula to put the fluid in. And it's not a needle, it's a cannula. It's got a blunt, rounded end to it. It's got a lot of little holes on it that let the fluid go into the fat. Okay. So the first part of the procedure, I put the fluid into the fat and do the numbing part of it. But it's also preparing for the removal of fat. And that feels like a little pinching under the skin. It's very tolerable. You feel very little as that's done. It takes about 20 minutes for that to occur. The next part of it is doing your contouring and sculpting. So let me talk about my technique for a second.
All right.
Because this is what it's really all about. It's all about what goes on under the skin. You're dealing with, many times, a thinner fat layer. And if this represents, if I don't know if the camera can get
green,
this.
we've got it. So the green
represents... If the green represents the muscle,
okay,
and the blue represents the skin, we're dealing with this layer called the subcutaneous fat layer between the skin and muscle.
Interesting, okay.
And under general, there's no way to get proper positioning, and many times what goes on...
That means when the patient's completely out...
When the patient's out,
you don't have control
you don't have control of their position. You're doing curved areas of the body with straight instruments. These are some of the cannulas I use. They're called micro cannulas. They're very thin cannulas that I have specifically designed for me. And what's going on under the skin, remember this is really a blind procedure, it's so tactile, is that I'm very careful
so it's
to
a feel.
always...
It's more of a feel.
Absolutely.
It's a blind procedure.
Even more than a seeing, a visualization, it's a feel. And I always want to know exactly where I am. And that's one of the problems I have with some of the new technology. You know, the lasers and ultrasound where you're melting fat, you know, to me, it actually, I don't have the same control. I've used those machines as physically sculpting and contouring and whittling that fat layer down. So under the skin, if you look underneath here, I start very deep in the fat layer, but I'm careful never to poke the muscle. You really can't under local anesthesia. The patient's asleep, they jump to the roof. But that goes on under general a lot. You're causing a lot of unnecessary bleeding and trauma, and the patient's asleep. You don't know, they're bleeding a lot. But as I move up in the fat layer, I'm careful to have a lot of respect for the skin. All the problems that occur with liposuction predominantly are how the skin is dealt with. I think as a dermatologic surgeon...
It gets poked quite a bit.
That's right. I understand how the skin responds, and you have to understand how the skin responds to get a smooth contour.
So you don't want to touch the skin, you don't want to touch the muscle.
You know, I'll tell you,
I've seen the procedure and I see a lot of poking. Is that why the tough downtime? The soreness?
Well, that's part of it, again,
bumps?
is the poking of the muscle, causing a lot more bleeding, and a lot of it is the trauma to the skin. And if you ever see the surgeon kind of lifting the skin up and tenting it, which I see all the time when I watch many television shows,
Interesting.
Or you see the surgeon poking the skin from underneath, what they are doing is they're irritating the collagen under the skin and getting uneven pullback of the skin, and that is the main reason for irregularities. You know,
like a bumpy result.
Yeah, you know, a lot of the work I do is revision work. It's fixing poor results, and the main problem I see is unevenness of the skin, and it all has to do with how the skin is dealt with from underneath. And that's why with a lot of the new technology, you lose that fine control. If you watch me do liposuction, I'm actually putting my finger on my cannula to feel always where I am.
So this is a harder way to do it, by the way.
I think
this is not the easy way out.
I think it takes more. That's right. I think it takes more finesse. You know,
for a better result.
Surgeons want to walk and have the patient be asleep and just get to work with things. I think it takes a lot more finesse to deal with an awake patient, to get them in the right state of mind, and to have a calm atmosphere, and to be gently putting the fluid in. It takes much more finesse to do it this way.
You say you do a cross-section technique or cross technique. What does that mean?
Well, you know, my website, I really go into detail about my approach to every area of the body. And I also go into the pitfalls that many times surgeons, the mistakes they made in terms of a bad result. But yes, I almost always crisscross my tunnels in two different directions, and I gradually move up in the fat layer. You know, there's so much more to this procedure than just sucking fat out. And the biggest mistake is to approach it from that standpoint. You know, patients many times say, oh, be as aggressive as you can be, suck out as much fat as possible. Surgeons many times want to boast and brag about how much fat they were able to remove. It's a naive approach. It's not the way liposuction is. You want to always make a judgment how much you're bringing area down. You're doing a woman in their late 50s or inner thigh area, the skin is very delicate. You better have a lot of respect for that skin as you're approaching the area. You're too aggressive in that area, you're going to cause unevenness and a wrinkled look. And
are there a lot of people afraid of this? The people that know, that means they would like lipo, they know they have these areas that they can't get rid of, but they're afraid.
Afraid of what?
Afraid of doing the procedure because of these unnatural looks.
You know, I told you that beforehand, that when we sat on the couch and talked about this, I said I really think the #1 reason
I'm surprised
people
about this.
are afraid about liposuction specifically is a bad result. And there's a lot of misperception and misunderstanding about liposuction. I think that, you know, you look at photographs of actors or actresses who've had it done with a lot of irregularities, and it turns the patient off to it. And that's why I talk about, you know, spend the time and learn and understand and educate yourself about this procedure. Understand as much as you can, take the time, see a few surgeons to make the right choice, because the most important decision you can make, and I'm going to say this in a very straightforward manner, it's not the tool. It's about the person behind the tool.
Like the artist, it's not the paintbrush.
Absolutely. It's never going to be about the paintbrush. It's about first of all, the integrity of the person behind it. Who is a good candidate, who's not a good candidate? We talked about that. There's a lot of selling
But you'll do big people
procedures.
too, though. You'll do. I mean, it's about balancing
I
out.
do
Is that right?
big
Is that what you
people.
say?
I do thin people. I do normal weight people.
Are they
It's
getting
all
leaner
about-
and leaner, by the way? These people that are coming
think
in
so.
for lipo.
I
mean,
think
you get models. You get. You get some people that are really world-class shape, but they want to pick it up a notch, or what?
Well, yeah, I think people are starting to understand the power of liposuction, and it's about balancing. It's about targeting disproportion. So I'm doing a lot more people who actually are using it to fine-tune their
Is
bodies.
that much easier to do, by the way? The thinner patient?
No, it's actually much harder to do, quite honestly, because anybody can take a person who's got, let's say a woman who's got big, huge saddlebags and bring them down and make them happy in clothing. Maybe their contour is better in clothing, but there's a lot of irregularities. Anybody can do that, and the patient actually many times is happy. But when you're dealing with people who are, almost normal weight or models, there is no room for error in those people. Any irregularity, any touch of the skin in the wrong way can cause an indentation. And in the revision work I do, it's very difficult to many times make that perfect. So, my philosophy is nail the result the first time.
What's the biggest mistake as you see it? And I know you're one of these guys. You say, Randy, I'm going to tell the truth on your show. When you're going to tell it like it is. You did that on your radio show. But what's the biggest mistake, if you had to say, in the world of liposuction?
The biggest mistake on the part of the doctor, I think, is not really evaluating who is truly a good candidate for liposuction, not having the eyes to determine how to balance a person's body out, and then not having really proper, meticulous technique. Many times being overly aggressive, thinking that the way to approach lipo is to remove as much fat as possible. It's the biggest mistake you can make.
Really?
The biggest mistake on the part of the patient is trusting a lot of the new technology and being swayed by a lot of this hyped up, aggressive, many times deceitful marketing, thinking that the machine is going to guarantee them.
The laser things like that.
The lasers and other things. There's a lot of non-invasive
You don't
things.
like the lasers? You don't think it's there yet?
I don't.
Okay.
Again, the biggest mistake is the patient trusting the laser, thinking it's going to give them a great result. The biggest mistakes I've seen
Help me
are
understand
with the
this.
lasers many times.
Is this an exaggeration? When somebody tells me, Randy, the laser goes in, this is a rep from the laser goes in, dissolves the fat, and the doctor now just sucks it out.
It sounds very alluring.
Is that just not true?
Well,
Is it overstatement?
the laser can melt fat. But this concept of putting in energy to melt a whole bunch of fat, to me, quite honestly, we talk about it, it's sort of loss of control. To me, actually, it's not there, and I feel that I get a better result with exactly whittling each area down.
Have you seen a lot of bad results with these laser
Absolutely.
lipo
I got to tell you,
techniques?
I do
Really?
a lot of revision work. It's about 1/3 of my practice. And the biggest disasters I've seen have been with laser surgery.
Is that right?
Not because
Okay.
the lasers are so bad, but because they're being done by people without good judgment experience. And that's the warning I have for patients, that their mistake is that they're trusting the machine.
Good. Okay.
Look for the right person.
So the most common area on women are saddlebags. Is that an easy area to treat?
Well, yeah, the most common area is saddlebags on women. I mean, it defines a woman's contour, from especially from behind. In ways, it is the most common, and it's not that difficult of an area. But I got to say, even in that area, there's a lot of mistakes that are made. And
Like?
I'll give you an example. Under general anesthesia, many times the patient's lying there with their leg flopped down. The surgeon contours the area with the leg flopped down. The patient stands up, you've got a big indentation there. So when I do the outer thighs in women, I make sure their leg is in a position where they're standing up so that there is no irregularity. Another mistake that's made in the outer thighs in women is that the surgeon many times will go horizontally. And as the buttock settles, it pushes down on those bands, creates irregularities. You've always got to stay vertical. I mean, this is getting into some of the details of technique that people don't really talk about it. Many times where your incision points are placed can affect the result with things. Not always just hiding the incisions. I mean, they heal in beautifully. But strategically, how you approach the area of the body.
Isn't the belly button the best way to go in the abdomen?
No. I hear this many times from patients and doctors. They like to go through the belly button. I mean,
Because there's no incision.
The patient likes it because they think that it hides the incision. I hate the belly button incision
Really?
because you can never really contour the abdomen properly. I like to approach it from at least 2 and ideally 4 different directions, lateral to your field when I do the abdomen. So, in the years I've been doing this, I defined what I really think is the best area to place the incision on every area of the body, and my website really goes into detail about that.
Okay. Is this true that liposuction, I mean, you're talking about it in great ways, but it's the #1 procedure for revisions, where people have to go back and get it done again?
It's one of the top procedures for revisions, absolutely.
Okay.
It's probably the most common procedure in the U.S. still think it is, and it's one of the most commonly redone procedures in the U.S. About 25% of liposuctions are redone
25%.
again.
Okay. What is your percentage? Do you
My
have
revision rate's actually 1 in 1,000. I almost never have to go back and make any corrections on my work,
Really?
and if I ever do, it's usually very minor. So we're talking
and it's
about once every.
because of the way you do it, your technique?
Yeah, I really think it is. I think it has to do with my technique and my attention to detail in terms of how I go about this procedure. I do not view it as a sucking out fat procedure. I view it to nail the result every single time.
So they look great in a bathing suit, they look great naked.
That's right, that's right. You know, to me, I eliminate any aspect of guesswork. In fact, when I'm in the evaluation with a patient, very quickly, I know exactly the result I'm going to get. I know exactly what should be done, how I'm going to approach it.
You compared it to a haircut earlier.
That's right.
How is it? Give me the comparison.
Well, I think the reason I compared it to a haircut, it may sound trite to some people, is that I think people understand that a haircut isn't about the scissors that you're using. It's about the person behind it. It's about their eyes in terms of what is going to look good on a person and being able to then technically get to that end point with things. And many times a person that's good with a haircut, in 20 or 30 minutes they can get a great result. You can have another person who can have the best scissors in the world take an hour and a half or 2 hours and have a lousy result with it. Liposuction's the same way. It's all about the eyes, judgment, artistry, hands of the person doing it, and less about the machine.
So the perception is, though, that liposuction is liposuction. It's a straightforward procedure, and you're saying it's not.
Absolutely.
Really?
Absolutely. You know,
it's just as complicated, in your opinion, as a facelift or any other procedure. Maybe even more.
Maybe even more.
Really?
Maybe even there's less room for error in it, because I think I got to tell you honestly, I rarely see in the stuff that I do really well done liposuction. I'll call a spade a spade. If somebody's had liposuction done and a patient's unhappy with it, they come in, I'll tell them, you know what, that surgeon did a very good job on you. But unfortunately, it's uncommon that I see that.
So the best lipo goes unnoticed, obviously. Is that right?
The best,
I feel like
right.
I could spot lipo at every pool. I'll say, that's lipo. You're saying I couldn't see yours.
I think it's like everything in cosmetic
I'm looking
surgery.
at photos from doctors.
Absolutely. The best on liposuction, nobody would know. It's like the best on nose job, the best on lips, the best on facelift. If somebody's had good work done, you'd never know. We all kind of point out, or patients point out, the bad nose job, the bad lips, the bad cheeks that are done. That's lousy work. That's poor judgment and artistry on the part of the surgeon.
Interesting. Okay, well, look, we're going to take a quick break. We come back. I want you to take me through the process. What happens on day one and downtime and things like that. You're watching The Wellness Hour, leader in medical news and information. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about liposuction. Now, we've talked about a lot of things today, from lasers to all the different technology. You know, I think your main point is that it's in the hands of the doctor. There's a lot of, how much percentage do you place on artistry when it comes to lipo?
Including technique, artistry, including technique?
Yeah.
I would say honestly 95%. I think very little of it is the science aspect of it. I think it really is the artistry of the surgeon doing it. But I would really say that anybody who's considering liposuction, any patient that is considering or confused about it, you know, first of all, take the time to educate yourself. Go on, I think the internet can be a great source. Go on and learn as much as you can about it. Understand different approaches.
I did. You're on the first page most of the time.
Yes, that is true. I think I've got a very good website too that I pride as being very educational and not just a sales tool. But learn, understand. You're going to increase your chances of making the right decision. The more impulsive you are and fall prey to aggressive marketing, the more you're going to increase your chance of making the wrong decision. And then choose 3 surgeons and set up consultations and pay attention to how comprehensive that surgeon is being in their evaluation. Do you feel sold to, or do you feel guided and educated? And you know, it is true that yeah, it's very important that in the consultation, you know, go see a few surgeons and make sure you feel guided and not sold to in that consultation. And yes, I think it is true. If you choose somebody whose practice is really based around one procedure, like mine with liposuction, chances are you're going to choose somebody that's a cut above with things, as opposed to somebody who is really being more of a jack of all trades.
It's not a recognized specialty, but this is your specialty. I mean, this is your focus. Is that right? Is that fair to say?
Liposuction is part of cosmetic surgery, yeah,
okay.
and it is my specialty. I mean, not only just the initial cases, but the revision stuff too.
You know, on the website, and I told you this off camera, people are always asking me for an endorsement. Who should I go to? And this is not an endorsement for you. I mean, people need to know this is a real interview. You're not scripted. You know, I checked you out beforehand, but people say, you know, who should I go to? And with any procedure, I said, look, find out how often they do the procedure. Is it like golfing? I mean, the more you do, you know, if you could get rusty, that means go to somebody that does it frequently.
Yes.
Look at their results. Make sure you like the doctor, and find out, and go to somebody that's a specialist. That's somebody that this is what they do.
Yeah, like I said, I think chances are
nobody would deny that.
That's right. Chances are you're going to be, with somebody who's a cut above by choosing a specialist. But I'll tell you, it's a very difficult thing. It's not always who's in Beverly Hills, who's been on TV a ton of times, who a friend recommended to you, maybe a couple friends that had a great result, who a doctor necessarily recommends you to go see, because they have buddies they like to refer to. It's a very difficult thing. That's why take your time, educate yourself. Pay attention to consultation. Don't always be skewed by before and after photographs. Understand that doctors are going to many times put up their best photographs. Probably the most important point is who is really nailing the result the most, the highest amount of times. Each doctor's individual revision rate, which unfortunately is not published,
Can
is
you
probably
ask that?
the most telltale factor. I think absolutely.
Like how many times do you have to redo?
Absolutely. If the doctor says, well, I kind of believe in touch-ups, I go back many times and fine-tune things. That's not my approach to liposuction. My approach is nail the result the first time. That's right. That's right. It's your best chance of getting the best result.
Is it a boost in self-esteem for your patients? I mean, when it's done, do you have certain patients that it's leveraged to start eating better? They start becoming more active. They're dating.
Yeah, absolutely. They're very enthusiastic about it beforehand. I take that to heart. I want to make sure I'm providing. I'm making them happy with things. So I feel a need to meet their expectations. But yeah, absolutely, I hear it all the time that their self-esteem is good. They're more comfortable in clothing or out of clothing. It motivates them to lose weight, which is, like we talked about, their responsibility, or to continue to work out. Remember, loose muscle I can't control with liposuction. That's what I call flat.
So just about every part of the body. And by the way, we are out of time. So legs, knees.
That's right.
The back,
almost
the
anywhere.
neck.
The neck, the male chest, the abdomen, the hips, the flanks, the outer thighs, the inner thighs, and I do some areas that are very, very technique, driven areas that very few people do. The calves and ankles, the anterior thigh area. These are areas that are not areas that you want to touch with liposuction unless you have a lot of experience.
All right. Well, I want to thank you for coming on the show, and it was a pleasure. I learned something. I think anybody that watches this
love talking about this stuff.
Thank you so much. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, you can visit our website at wellnesshour.com and just put in lipo or Dr. Armon. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.